So, hi, I want to thank you all for using your Thursday night to listen to me talk. I promise I'm not going to go on for very long. I just really want to introduce the service that we're offering and are partnering with NPA and how we can help you and your customers. So, my name's Katie Napton. I'm a physio. I've been a physio for over 30 years, and I've worked both in the NHS, more latterly in a private practice, which I still am working on now. And I'm passionate about musculoskeletal health, empowering patients onto self-management journeys and really getting the right information to people as quickly as possible. I also have a special interest in women's health, and I also work in neurology as well now. So I've become more of a generalist the older I've got, mainly just because that's what patients need, and I'm very patient-centered. So a little bit about PhysioFast Online. So what is PhysioFast Online? It's an online physio clinic. It was actually established in 2016, so pre-pandemic, so before we were so used to all this Zoom meetings, webinars, and telemedicine as it is now. Mainly because I just recognized that people needed to access the right information, be given the right advice, and the sooner they got it, the better, and the less they were going to suffer. And some of this was just from clients that I had who had been poorly managed, and by the time they got to me, the problem was a lot greater, more complex, and potentially quality of life limiting. So this really depressed me, and I wanted to try and do something to help. So I set up PhysioFast Online because I recognise nationwide there's a lot of really good quality physiotherapists who can help people just via a video appointment. So quality was my first priority. I wanted it to be accessible and patient-centered. I wanted people who knew how to manage video consultations because they are slightly different. They take certain skills. So all my physios are specially trained to get the optimum from it so that patients really go away feeling that they've done something that's been worthwhile. We do collect outcomes. So at the moment, we're using PSFS, which is validated. And we also collect feedback from patients on how they found the experience. And our feedback and our outcomes are actually amazing. So I'm really happy to talk about those at some point. So I thought you might want to see actually how an appointment works, because the normal problem is physio's about hands-on, and I am still a manual therapist and I have no problems with manual therapy, but we do know that actually, if you're given the right information and advice, we are designed to heal. And sometimes that's all people need. So this is just a very short video, just to give you an idea of what it's like as a patient, how the system works. Welcome to your physio appointment today, Lizzie. How can we help you?
It's easy and convenient to access an online physio appointment at PhysioFastOnline.co.uk. Just pick a time that suits you and a qualified physiotherapist will treat you via video, providing expert assessment, advice and reassurance. You will also get a bespoke rehabilitation programme to follow. We look forward to seeing you online.
Sorry, I probably interfered with that video, but yeah, so it's just showing you it's simple. So the appointment is, we'll have a discussion about that patient's presentation. So just like any ordinary appointment, we've got a bit of eye contact. We can really delve into that history. If it's been a longer history or if it's been a short one, it doesn't obviously take as long. And we can cover any special questions or anything that may be raising any concerns. But the great thing about a video is we can look. So it doesn't have to be a sit-down appointment the whole way through. I get people moving. I move myself. We get them doing arm movements, special tests, anything that would be worthwhile to help get that diagnosis. So it's a really thorough assessment. And then what we do, as you saw on that video, is that they're sent a bespoke exercise program and potentially some information about their diagnosis. Now, that is at the level that's specific for that patient. We live in a world that there's sort of information overload, and it's really working out what's relevant to them. So it's not, this OA knee patient I gave OA knee exercise to. This is Mary, who likes playing bowls, walks her dog, and happens to have OA knee, it needs to be on an individual level. I'm really keen on that, keeping that humanity in healthcare and it not being too driven by sort of digital apps and things, although they have their uses. So you'd be wondering who is suitable? Well, actually, this is what's really fascinating. So we treat a whole range of patients. So I've treated an 8-year-old and I've treated a 93-year-old. So age actually isn't a limitation. So yes, we have quite a glut of those 30-something runners. We've got a few ultra marathon runners on our books and triathlons. So all those mad keen sports people who you can see the online environment works really well for them. They're time poor, they tend to overload, they're running and they need advice and really controlled exercises, and potentially also need a really guided program of training. So we can do that. But we also treat a lot of the sort of mid-40s ladies. So we know that perimenopausal and menopausal women are sort of 50% more likely to present with muscle and joint pains. And we do definitely deal with a lot of those. So in terms of their specific joint pains, obviously we can give them advice, but we can also give them health and well-being advice. So we're all trained into talking about sleep management. We can give some brief advice on nutrition, and generally how to deal with any of those signs and symptoms of the menopause, which is sort of quite highly publicized at the moment. So we do get a certain amount of those patients coming through. But we also treat a lot of 60 pluses. So those could be the OA knee that's a bit troublesome, or someone waiting for a hip replacement. The NHS lists we know are struggling a little. So we can give them that extra bit of support. We also get quite a few people who are on waiting lists and not quite sure what to do, or they're delaying going to see their GP about a problem. And so they tend to book a one-off with us, and we'll have a conversation and we can guide them on what would be the appropriate path to take, whether they need to go to the GP, in which we can actually help provide them with a letter so they know where this is going, and we can give them lots of information that's relevant for them. We also deal with some neurological problems. So people who've had strokes who are at home, not quite sure what to do, or their carers aren't quite sure how to position them, or whether they should be doing any exercises. Or we get carers who can't leave their loved ones and actually still need advice because they've strained their back or hurt themselves. So there's a whole range. The only people that I would say is not relevant for is people who are just not going to cope with it, who can't comprehend or who struggle to express themselves. So if there's a real communication issue. So this is a video with patient feedback.
Hi, my name is Alison Spilling and I'm a paper conservator. In June 2017, I had to have my ACL repaired and used the services of PFO to aid my rehabilitation and recovery. I was able to go on and ski with the family in 2018, and after that I've been able to learn to ride again and support my daughter through her equestrian achievements, and also have gone on to actually support a charity close to my heart, Macmillan, and do the Mighty Hike last year, which was 26 miles long along the south coast.
Hello, my name's Jill. Just to say, I've used PhysioFast on 3 separate occasions over the past couple of years. It has actually been a godsend to me because I was too scared to go to the doctors or to have a scan because of the pandemic. I found them on the internet because they seem to have good reviews. First of all, I fell off my bike. I didn't know if I'd damaged the meniscus or the ligament. As I say, I was too frightened to go to the doctors. PhysioFast really helped me. I had great support from them. They gave me exercises. These I could run off, print off, and also there was a video, so they were very clear. The first physio was really very professional, diagnosed my problems, and did it with such confidence that that I would recover, even though I didn't think that I would. And I was very pleased that I did recover. After that, unfortunately, a while after that, I injured my arm, again exercising, and I used a different physio, but she was equally as good. Same clear instructions and fully invested in me.
Hi, my name's Paul. I've been running for about 25 years, and just recently I've been struggling, well, recently, probably for the last 3 months, struggling with my ankles, calves, and in particular one knee. Obviously don't want to give up running, so I started to look around on my forum. I'm a member of an online running group and a running forum associated with that. And what was worrying was that a lot of people have been told by their GPs just to give up running. For me, that would be a last option rather than the first option. So I guess I kept looking around for something more suitable, and I found PhysioFast Online. They were great for me. It meant I got an appointment the following morning. I could fit it around work, and within 24 hours, I was chatting to someone online about my problem. Didn't have to wait 3, 4, 5 weeks for a referral. Didn't have to wait for an appointment, and we could get cracking. I was able to explain my problem, use the video camera to point to where I had issues, and really talk through what the problem and the pain, where the pain was for me, and where I was and where I wanted to get back to. The physiotherapist was really great, talked me through what I could do.
Hello, my name is Jim Scott, and I just wanted to talk to you about how PhysioFast Online has worked for me. I'd been suffering some pain in my hip for over 6 months, and on a day when I was particularly feeling it, just thought to myself, I really ought to get myself some advice. I didn't think it was something I could take to my GP, and with a very busy schedule, I didn't really want to have to travel for an appointment. So as a result, I checked to see what I could find online. In no time at all, I'd found PhysioFast Online's website, and within a few minutes had very easily booked myself an appointment a couple of days hence, and also at a time entirely to suit me. At the appointed time, I made my connection to my physio very easily, and in exactly the same way as she would have done if we'd been meeting face to face. My physio was able to check my history and also all my physical movements before giving me a diagnosis and roughing out a treatment plan for me.
So, I mean, we get lots of interesting cases. So I just brought up a couple here, which really, for me, just highlights the joy of having a video consultation. So on the left is a 49-year-old who had been out running and presumed she developed some ankle pain, and she presumed that she must have gone over on it. She had a phone call with her GP, who talked about a sprained ankle and suggested that maybe she self-referred to physio. She couldn't get in contact with her local physio clinic, so she came to see us. Obviously, on assessment, she could point exactly where her pain was, and following the Ottawa ankle rules, it was pretty likely this was a stress fracture. So straight away, she's sent off by our clinic to go and have an x-ray, as we are assuming that it is a stress fracture, and indeed it was. So she was, typically put in a boot for 6 weeks and did really well. But that was the joy of the video, picking that up. On the right-hand side is a lady who was actually under the hospital. She had quite a complex history, which I won't go through, but she'd recently deteriorated. She was under the hospital and was awaiting treatment. She was under the spinal clinic. And her son had got really concerned about her deteriorating, and so had organised an appointment for her. She wasn't very technically savvy, but we managed through, and we went through her long history. And the main thing was, when she lifted up her hands and I saw her feet, she had quite obvious dactylitis, which was indicative of some sort of inflammatory condition. And so from that, I could write a note to her GP and raise the concern and the importance of referring her actually to rheumatology. and that, you know, following the NICE guidelines, they actually needed to see her within 3 weeks. And yeah, I've had some very grateful texts from her following up from that, in that she's now taking appropriate treatment and is doing really well, but has been diagnosed with rheumatoid arthritis. We've had a few more than that, but we perhaps discuss them in a minute. So how does this work? So it's free to sign up. All you need to do is, if you go onto the NPA website, at the bottom of our page is a very short Google form to fill in. And what you'll get then is you'll be sent a specific code for your pharmacy. Now, with that specific code, it means that your customers will get, I think it's just over £1 off, and you will also get commission of 4% for every appointment that that person or anyone takes. That number you can obviously put on your website. We tend to send, if you request them, we send business cards, but we perhaps could discuss the best way to move that forward, because we'd really want to help your customers. So it's simple, it's free. And we know, I mean, one of my board directors works for NHS England, and they recognise the quality of the service that we offer, and they recognise the need, because we know the NHS isn't coping. So what I want to talk to you later is, how can we help you? What will make it you use the service? And if there is any concerns, how can we help you with those concerns? So this is all my contact details. I am more than happy to have a chat, discuss anything, any queries, concerns, questions. We have a support desk that any of your customers can send any queries that they might have in. I also have a 50-minute meeting available for you if you have any queries or anything that you would like to discuss. I'm really keen to make this work. I'm really keen to help people, and we are available to do that. So I'll stop the sharing now, and then perhaps we can have a chat.
Great, thank you, Katie. I did notice that we had one in there just asking about the cost for the consultation per session, which I think you kind of answered, but
well, not really, no. So we have two appointment times available. So there's a half-hour or a 45-minute, and it's really up to the patient to decide what they choose. If they're more complicated, we tend to hope they go for the 45 minutes. So a half-hour consultation is £37.50. Your customers, if they've got a code, will get, it's worked out, I think, at £36.25, and then it's £48 something for the 45 minutes. So they get £1 off, but it is really quite affordable for the quality of the physios that you're getting. So all the physios are sort of 10-15 years experience, and you know, have a lot of knowledge behind them. So I haven't had any patient yet who hasn't benefited from having a session from us. There are also the specialist appointments, which are all 45 minutes. So that's your neurology and your women's health. And that's, with the women's health, we also deal with incontinence. It's a great place for those first conversations when someone might have a little bit of stress incontinence that they're not really talking to anyone about. So we found those sessions really useful. We also have access to if someone does need imaging, we can refer in for private imaging nationwide. We've got a contact with that, but we try and avoid that unless they're really desperate to and they're not going to get it on the NHS.
yeah, and what's really interesting about that is you don't have that 6 week or 10-week wait to see a physio. It's almost instant. I guess what we want to know is, why are more pharmacists not using this product, and how can we get more pharmacists to use this product? Does anyone out there have any comments on, you know, what would stop you advertising this to your clients or your patients? Not sure if we're going to get any comments back. We've got a quiet crowd in today.
Yes, I think a lot that holds people back is they're really concerned that people aren't going to cope with it. But it is really simple. As I said, I've treated a 93-year-old on this sort of system because we've made it as simple as it can be. So they book a time, they book a physio, and then they pay for it, and then they're sent an email, and on that email confirmation is a link. So all they need to do is they click the link. There's no requirement for download or anything. So it's straight through to the physio. And as I said, we try and do that it's holistic. So it's not just focusing in on that problem. We try and check that we're giving them tips for general lifestyle changes as well. I think probably most of us have noticed that frailty has really been a problem post-COVID, and lots of the elderly have not got back to their normal activities. So we're really keen to promote balance exercises and really push things forward. So all the physios sort of know to try and do that, but we also try not to overload. So most people are sent away with 2 or 3 exercises and maybe some information and advice that's pertinent to them, because there's nothing worse than having sort of 10 to 20 sheets of exercises that don't make any sense. So I think we got another question. Yep. So are there any typical presenting cases which we could concentrate on spotting first and recommending in our pharmacies? Well, I guess it's any of those that are really struggling with say pain, or they're waiting for something to happen. So some of those sort of early OA knees that actually, if they had someone just encouraging them to do a bit of movement to work on some strengthening, we could stop them deteriorating as quickly. And even if they are a surgical candidate, the dreaded bone on bone, which we're trying to ban doctors saying because it's really not useful, they can actually make progress, but they just need the right support. We also do quite a lot with persistent pain patients, so the online environment really sits well with that. So we talk about pacing, about managing, about goal setting. I use quite a lot of, and you might not be familiar with him, it's Pete Moore, who's done a pain toolkit, who was a chronic pain sufferer himself, and it gives some really sensible tools to try and get people managing their life. So that can be fibromyalgia or your chronic persistent back pains. So we do quite a lot of that, and those are in general patients who've had potentially quite a lot of manual treatment, and we know that sort of thing isn't working for them anymore, but they need someone knowledgeable to guide them through to try and get to the next stage.
Yeah, and I guess a big thing of that as well is with the women's health issue. I mean, the whole HRT and menopause is such a big topic at the moment, and of course the whole perimenopause as well, because people don't recognize that, oh, actually these aches and pains are, not just general old age.
Yes, well, you get a lot of so I think I've had, through all of our clinicians, there's been a number of people who've been diagnosed with fibromyalgia, which we've then, because I actually also do some work with a menopause clinic, but and we've then found out that actually it was a perimenopausal symptom rather than fibromyalgia. So yeah, it's really vital.
Great, thanks, Katie. I mean, I don't have any other questions at the moment. I'm just looking at Q&A. No, I haven't got anything there. If anyone would like to ask anything to Katie, now's your chance. Otherwise, I'm going to say thank you so much for joining us this evening. Really appreciate it. Just to let the audience know that this will be available on demand, and we will be sending out the link as well. So if you've missed anything, more than welcome to watch the video again, or to contact Katie directly, and I will put her details on that email to you tomorrow. Otherwise, thank you very much for joining us.